Hi, hello, hi. Welcome back to my YouTube channel. Thank you guys so much for joining me today. Today, what I want us to talk about is really something I've been thinking about for a very long time, and I wish I knew this information as an immigrant or as a new immigrant. This information is really for everyone, young, old. So let's get straight into it, and hopefully you find this information really helpful that will be able to inform your decision. So as immigrants, once we come into the country, we're faced with a lot of information being thrown at us, and to be honest, if you don't have anybody guiding you, you're kind of lost. You're kind of in the weeds. You're trying to find really the best thing that works for you, and you end up being left at a place where you don't really have an option. You either have to be there because you have to take care of yourself, you have to feed yourself, you have to feed your family, you have to feed your family back home. One of those information is the kind of jobs really we can apply for. As immigrants, we are limited regardless of your education, your background, because not every certificate, not every degree, not every learning experience will be able to transfer. Obviously some may, but most of them will not be able to transfer, and you have to start afresh. A lot of people with qualifications end up doing like manual jobs, warehouse, delivery jobs, store positions, home health care aides, nursing assistants. Not to say each and every one of these jobs is not good or is downplaying any of them, but some people really have a lot of qualifications that they can venture into other things. They can look for jobs that will make use of their talent, will make use of all the learning experiences that they have acquired throughout the years. Today specifically though, what I'm going to talk to you guys about is more of the careers or job options in the medical field that do not require a bachelor's degree. Once you're done with high school, they're easy to go into. You only need a certificate or an associate degree, especially if you're confused as a young adult where you want your life to be headed, if you want to actually go to college, if you want to actually pursue a degree. If you're starting to figure it out because it's a new environment, it's new information, and you're just trying to get the best fit for you. There are so many options, but I'm going to talk to you guys about just 10 medical careers or medical jobs that you could go into that only requires an associate degree or a certificate. Is being a phlebotomist. Okay, that is someone who draws blood. They are in the office, they are mostly in the hospitals, but this job I wish I knew it earlier, but I got to know it like around 2017-ish. It doesn't take long to do. Ohio School of Phlebotomy, really, you could take anywhere from a month to 6 months to get a phlebotomy certificate. So this is really something easy you could go into if you're trying to figure out if college is for you. Obviously there are some tuition you have to pay, but it's better than wasting your time in college when you're trying to figure stuff out and you don't have like a plan yet. So phlebotomy is like great to go into it if you're not afraid of blood. If you're not afraid of blood and you like the medical field, you like working with people, phlebotomy is great. Second one I want to talk to you guys about is pharmacy technician. So that people that are in CVS, when they give you your medication, all those people are pharmacy technicians, and they're not only in like drugstores, they are also in hospitals actually. And mostly you could do it as an associate degree, but also you could do it as a certificate. It mostly takes about a year or so to get, and I will put some links below for you that you could go check out. I know it's different from state to state, but feel free to ask me any question and I'll see if I can find some resources that I can link below. The third one is being a surgical technologist. It can take anywhere between a year to a year and a half, and these people are mostly found in like surgery rooms, operating rooms, and they are the ones that are handing instrument to surgeons. They are helping the nurses. They are comforting the patients. So they are mostly help to all the other medical personnel in the operating room. So if you feel like you will go into the medical field, or you want to get like first-hand experience in the surgery room, this is a great place to start. Number 4 is being a medical assistant. We all know medical assistants are everywhere, in doctors' offices, in hospitals. Basically, you can find them everywhere, and this mostly takes about a year as well. They do anything from office work to taking blood pressures, doing lab work. So if you're also interested in the medical field but do not know exactly where you fit, that is a great place to start. Medical assistant, it doesn't take too long, a year, and they are really experienced. Okay. Number 5 is being a dental assistant. So dental assistant is different from a dental hygienist. A dental assistant, they are basically doing a lot of preparatory work. So they are helping the physicians, they are helping the dental hygienists. They are also doing some office work, so they are not the ones cleaning, taking the x-rays before the physician or the dentist actually walks in. They're just helping run the facility. So in Ohio, you actually require just a certificate, but to be a dental hygienist, you have to actually have an associate degree. So that is the difference. You could do that in a couple of months or some few weeks to a year. But so the next thing that requires an associate degree is being a respiratory therapist. Okay, they treat breathing disorders, so anything from asthma to emphysema, and they work on neonates, younger like babies, to elderly. So they work with a wide range of people. It is really a fulfilling job, and it's really high paying. The next one also requires an associate degree, being a radiologic technician or an MRI technician. So the people taking the x-rays in orthopedic offices and a lot of the hospitals, those taking MRIs, all these people are trained to do those things specifically. So the minimum for an associate degree mostly is 2 years, but if you're a fast learner, you could do it in a matter of like a year and a half. I really like this next one because I just fancy how it is done, and being in medical school, I've actually seen how it is done, but this one is EKG technician, electrocardiogram technician. A lot of people do EKG for various reasons, stress testing, if you have cardiac problems. And to be honest, in Ohio, there are no like laws regarding like the training or certification. They are under like the nurses can delegate to people who are not licensed to actually do the EKG. But there are also places you can go to get a certificate. So why not do it? Anywhere from 6 weeks to about 3 months, you'll be able to get that certificate. The 9th one is being an EMT. EMT is different from paramedic. They're kind of doing the same things. Paramedic has more advanced training, and a paramedic is mostly an associate degree as compared to an EMT. It's low stakes as compared to a paramedic. But when we say these people are first responders, they really are first responders. I have gotten the opportunity to see what is actually in the bag of an EMT or a paramedic, and they really can do anything from diabetes to CPR to allergic shots, so everything. Okay, so these people are really essential in the medical field. They need to be there to be able to help these patients who are in critical condition in emergency situations before they can get to the emergency hospital. The last one, I actually totally love this one because my dad is one, being a sterile processing technician. So being a sterile processing technician, these people are the ones that are doing decontamination, organizing, and packaging all medical instruments before they are used, especially in surgeries. Are actually the ones that are preparing these instruments to be able to use in the operating room so that there are no infections. So these people are really, really critical in the medical field or the medical experience, because once the decontamination is not done properly, you know, it can affect the patient. It can lead to really serious things. That my dad did not go to school to be an SPT. He kind of went into the job because he was working in the hospital. He saw the opportunity, got the job, and once he was in the job, he took the exam and he now has the certificate. So to be honest, when you see something that is open, an opportunity that is open, any place that you feel like you'll be able to do, be able to contribute your talent to, go for it. And if it requires a certificate, just get the certificate whilst you're on the job. Whilst you're getting that experience, you use that to get the certificate. Obviously, they give you a certain number of months or a certain number of years to be able to get a certificate in the particular field you are. But these are all the information I have for you. This is specifically in the medical field, and this is not exhaustive. There are so many things that you could do in the medical field, but I thought these were like really simple ones, that everyday things that we see that a lot of people do not pay attention to. Like, it differs from state to state, so please take note and do your research. Know the requirements you have to get before entering into a specific career. You really can do anything you put your mind to, so be encouraged. There are so many things, and I hope I'll be able to bring you that information. Thank you so much for joining, and God bless you. I will see you later. Bye bye.